Great. So let's get started. We're super excited today to chat about two projects that broke barriers during COVID. One from the Department of Public Health in San Francisco with Exigy, and one from the California um, Child Welfare with Code for America. These projects share similarities, but differ in how the teams dealt with the challenges during the pandemic. First, let me introduce myself. I'm Sasha McGee. I'm the technical director at San Francisco Digital Services. We're a digital services team within San Francisco city government. And before coming to SFDS, I spent 4 years at 18F, which is one of the federal government's digital service teams. And now I'll let the panelists introduce themselves. Siobhan, do you want to kick off?
Sure. My name is Siobhan Nestor. I'm director of the Family Planning Program at the San Francisco Department of Public Health. My program provides training, technical assistance, and quality improvement support to 12 community-based clinics that are part of our safety net system, including 5 youth clinics. And I'm excited to be here.
And then my name's Alexis Fernandez, and I'm the SNAP or CalFresh Director at the California Department of Social Services, where we oversee about 7 federal nutrition programs, now 8 if you include pandemic EBT, the largest of which is the CalFresh program, or commonly known as SNAP, or the food stamp program here in California.
Hi everyone, I'm Wendy Fong, a lead designer at Exigy. Exigy is a B Corp that partners with social impact organizations to build and design technology for healthy and resilient communities. We're focusing in the civic tech, health, and philanthropy verticals.
Hi, I'm Rachel Edelman. I'm a senior product designer at Code for America. Code for America is a national nonprofit based in San Francisco, focused on increasing access to government services through technology. And we've built a sort of long-term relationship with California Department of Social Services through running Get CalFresh, which is our product that supports Californians applying for CalFresh.
Excellent. And before we get started with the panel discussion, it's pretty important that we set the background for both the San Francisco Department of Public Health Sexual Health and Teens program and the California Department of Social Services and California Department of Education's Food Relief for Kids and Family projects. So Wendy and Siobhan are going to give us a quick background on the San Francisco project, and then Alexis and Rachel will tell us a little bit about the California project.
In San Francisco, when COVID started, 4 out of our 5 San Francisco Department of Public Health youth clinics were closed because clinic staff were reassigned to COVID duty. It's important to note that these clinics serve young people between the ages of 12 and 24 and provide both sexual health, mental health, and other sorts of health, primary care services. We knew that the closures happened very, very quickly. Youth did not know how to access needed sensitive sexual and mental health services. We also knew that a lot of our youth were facing food shortages and housing instability because of COVID. So we had a real challenge in communicating the available services for this group. Especially because this is a group that doesn't necessarily trust easily and doesn't have access to ready information, particularly for those young people who were living with their parents. We were very, very lucky to be able to work with Wendy and Exigy on this project, and I'll turn it over to Wendy to add anything that you'd like to add.
Thanks, Siobhan. Yeah, when Exigy partnered with Siobhan's team and the Department of Public Health, it was pre-COVID. So we'd already set the groundwork for understanding the needs of the communities that we're serving and engaging internal stakeholders. But when COVID hit, we knew time was of the essence to get critical public health information out to SF residents. And as part of our rapid and agile design process, we built upon an existing sf.gov pattern library from our collaborators at SF Digital Services. We tested rapidly and integrated user feedback into the production of the campaign. And most important of all, we were able to train content authors to empower them to publish their campaign within 2 weeks.
Great, Alexis?
Great, thank you. So I mentioned in my introduction that we oversee at the Department of Social Services the CalFresh and Nutrition branch. So we regularly provide monthly food benefits to households with low income. So it's important to understand that role in kind of knowing the context in which we operated pandemic EBT. Congress, under the Families First Relief Act, authorized states to issue additional food benefits under a new program, pandemic EBT, to kids that were not able to access school meals consistently during kind of the immediate aftermath of the first stay-at-home order and kind of movement across the country to close school facilities. And so without that reliable access to school meals, Congress decided to authorize an additional food benefit that would be available to them on EBT cards. So we as a state, in partnership with the Department of Education, applied to operate this program known as Pandemic EBT. And by the end of August, early September, we've issued cards with benefits available to about 3.7 million eligible kids. And so to get there, the program sought to serve up to 4 million kids. That's how many were eligible. About half were known to us at the Department of Social Services because they receive other public benefits like CalFresh, Medi-Cal, or CalWorks. Maybe they were in the foster care system. And so about half of them were known to us, but the other half were receiving school meals, but not necessarily in our database. And so we had incomplete information about who they were and really had to think about how we would get the card into their hands, specifically something as simple as a recent mailing address to make sure that card got to the right person kind of became a challenge. So on the back end, we have invested a lot of resources into data matching and working with our Department of Education to make sure that all kids were issued cards, or as many as possible that were eligible were issued cards. And so we really needed to quickly establish a process for data matching and serving the kids that were known to us, and then the kids that weren't known to us, establishing a process to easily collect that information. So we were able to verify their eligibility and get them a card. And that's where our relationship with Code for America came in. As Rachel mentioned, we've been working together for quite some time on a tool called getcalfresh.org. It's an online application assistance tool that moves you through the CalFresh application process quickly. And so we took what we had, what we've learned over time in serving clients through that tool and applied it to pandemic EBT. And Rachel will tell you more about that, but it really needed to be a client-friendly, accessible process that would guide families to providing us the correct and necessary information, just what we needed, not anything more, to make sure that we can get that card into their hands effectively. So Rachel will talk a little bit more about their role, but it was really about quickly standing up data matching, and for those kids where we didn't have all the data, collecting it so we could conduct that data matching. Rachel?
Great. Yeah, so Code for America was really excited when CDSS came to us with this. And from the start, we knew that our sort of mutual goal was to make sure that as few families as possible actually had to fill out a form. So that's where the data matching came in. But that being said, because we run Get CalFresh and some other projects related to government services, we do have a lot of experience building great forms. And we knew that for people we couldn't find with data matching, we wanted to provide that. So when faced with this sort of brand new nutrition program that had just come into existence, I was able to pull almost all of the components that I needed from our existing design system, also able to reuse a lot of user flows from other products. And all that sort of background experience let me start this project on a Tuesday and have a prototype ready for everyone to talk about on the next day. This sort of system in place also really helped us with onboarding new designers. I moved off to this project near the end, and the new designers were able to seamlessly pick it up because they were familiar with the design system. And there's definitely no way that our engineers would have been able to stand this website up so quickly without having those building blocks. And I think the most exciting part of this, or one of the most exciting parts of this, was that after we launched this website in California, we were able to reuse almost all of it to make a a version of it for the state of Minnesota as well.
Excellent. Cool. Thanks everybody for their introductions to their project. So the first question we have is, what were some existing challenges you faced in your field, and how has COVID-19 worsened or further complicated that work?
So I think I'll go ahead and kick us off on this one. I think for pandemic EBT, there were a couple of challenges that are more programmatic, at least up front. So familiarity with a new benefit program, right? So pandemic in EBT was entirely new. It served a population that I would say was new to EBT because they're not necessarily on CalFresh food benefits. So there is this issue of familiarity, serving newly eligible clients, and making sure they're getting accurate information about the process and eligibility, right? It's tough in a moment of crisis to cause more confusion for folks, and so you want to provide as much accurate information as you can. There are generally challenges that we're facing that aren't just about PEBT, and that is that in crisis, circumstances fluctuate a lot. And so income and needs-based programs have to react to very changing situations. And so for pandemic EBT or for CalFresh, when you're looking at eligibility as points in time, it'll often change from there. And that means there are newly eligible people to be served, people who may not have been, in the example of school meals, or PEBT receiving school meals ahead of the pandemic, but were eligible after the pandemic. And so just that fluctuation in circumstances requires that we adapt quickly and make sure that there's an ease of application, ease of service, and that we're responding to that, because often it's ever moving. And then I would just say a challenge that I'm sure many colleagues in the world of government would say they have experienced is the need to do things quickly and the desire to do things perfectly. And those two things often can't happen at the same time. So balancing the, again, need for expedient access to benefits so that families are served as soon as possible, with the need to want to do things perfectly, but recognizing that it may not be perfect and you're really looking to get as close to it as possible quickly. And so those are some of the challenges we're seeing as we continue to try to do this work in response to the pandemic.
Great, thanks, Siobhan.
Yeah, I think that one of the things that we were already dealing with the aftermath of COVID when we started work on this website. We knew that youth were having difficulty accessing services. We had really organized people to address this issue. I think one of the biggest barriers for anybody working in a large bureaucracy is getting permissions. And I think we were lucky in this particular case that Exigy already had the existing relationship with the San Francisco City and County, and so a lot of those permissions for the website were set up. Like I said, the other thing is that we had already been working with about 15 agencies to really coordinate youth services throughout the city with the existing resources. And within that group, we had a lot of people who were in management positions who were in direct contact with the folks that were required to provide us with some of those permissions. But I do think that the biggest complication for us also within COVID is, and this is a complication that we see in health services just nationally anyway, is that we were all already working, I think, with smaller staffs. We were understaffed and under-resourced. And COVID-19 just further complicated the work. Again, this relationship with Exigy, the existing, being able to use existing templates, already having certain permissions in place, also having a commitment through our larger stakeholder community to making sure that youth continue to have access to services really helped us to meet some of those challenges.
Great, thanks. So how did you prioritize what absolutely needed to be included and what needed to be reconsidered? Wendy?
Yeah, well, I would say our North Star was creating a web campaign that was above all accessible, informational, and a safe space. It was essential for us to ground ourselves in the needs of teens and transitional age youth. So we asked ourselves, what's the most effective way to communicate with our intended audience? And part of our human-centered design approach included language that was conversational and without judgment, informative but not clinical, direct call to actions on how to get help, visually engaging illustrations, and a vivid color palette that you might not expect from a government website. We didn't have to reconsider much because we're already building in a lean and agile approach. So this means getting the important resources published ASAP and then making adjustments based on analytics and feedback after publishing.
Thank you. Rachel, how about your team?
Yeah, I think our team had some pretty similar goals to what Wendy just said. We knew that access just was not negotiable at all. People needed to apply for PEBT using the technology they had available to them. The process had to be simple, and it had to be in their language. And we also similarly wanted it to feel official and trustworthy, but we knew that some of the people we were trying to reach had some concern or fear about interacting with government services. So we wanted to emphasize the school and family aspect for sure. And all this meant building a fast mobile-first website, using plain language throughout, and translating it into multiple languages. And for sure, managing the copy iterations and translations was one of the bigger challenges of this project. And ultimately, 20% of the applications we processed were in a language other than English, and a full 85% of our traffic came from people on smartphones. In terms of things that we chose not to prioritize or weren't able to do, we did make the decision not to offer client support on the website. In many of our other projects, having a live chat feature is really key, both for learning about client challenges in real time, and obviously it's helpful for the clients to have someone they can reach out to and get answers from. Ultimately, we just didn't have the staffing for it, and because we didn't have access to case statuses, we got the applications and we sent them to CDSS, but we didn't have access to what happened beyond that really. We would have been pretty limited in what we could actually help people with. So that's something that would have been really valuable, but we made the decision not to go forward with that.
Excellent. So obviously the crisis made a lot of things really hard, but what did it allow you to do that would have been more difficult under other circumstances?
So I'll start us off here. I think we are, I don't know if you'd say proudest or most excited about the opportunities to serve a population that we typically wouldn't serve at scale. So pandemic EBT was available to kids that were eligible to free or reduced price meals. That eligibility is a lot more flexible than CalFresh eligibility, specifically as it relates to income and citizenship status. So we were able to serve families that we wouldn't
I think we lost Alexis.
oh, am I on the wrong one?
There we go.
I am. Go
Now you're
ahead.
back.
Oh, sorry. One of the silver linings of moments of crisis or emergency response, which we do a lot of work in response to wildfires and things like the pandemic, is that you have access to additional supports and resources that you typically wouldn't, and people are motivated to move quickly. So that sense of urgency can help you move big projects forward that typically you may not have resources for, and that is both from a staff capacity perspective and a financial perspective. And so that sense of urgency can be something that you use to your benefit to move things that would be considered really big lifts forward, and often much more quickly than you usually would.
Thanks, and Siobhan?
I would agree that that sense with Alexis, that sense of urgency really drove this project. I really do not believe that had COVID not happened, that it wouldn't have taken us at least 3 months to develop it, to develop the content, to get the permissions. And I think that that urgency really ensured that people were able to dedicate the time that was needed and to really get the permissions quickly. I also think what is interesting for us, and I think for the whole healthcare system, of course, is that telehealth and online communication has become a lot more important in the services that we provide. And I think that this project allowed us to leverage some of that as well. And that's, I think, an important development overall for healthcare systems that came out of COVID.
Excellent, thank you. So the last prepared question we have is, what has your team learned in the process that might stick post-COVID?
So I'm happy to go first. I would say, first of all, I don't think this is a new lesson, but I think it reinforced the idea that relationships are everything. I think if we didn't already have the strong relationships built that we had with the various stakeholders that we work with, that this project would have been possible. I also do think that it really made the point that when you have a good interface and you have a good product readily available, and you have the will, it doesn't have to take quite as long as a project doesn't have to take quite as long in a bureaucracy as it seems to need to take. And I appreciate, you know, the speed with which this project was completed. And I really hope that we take that kind of a framework and process for working and are able to apply it to other projects in the future.
Yeah, speaking of bureaucracy, my main takeaway has been keep calm and carry on. The city may have quieted during shelter in place, but social services and programs were needed more than ever. So how can we as designers, technologists, and civil servants be creative and adapt to these unprecedented times? It was interesting to see bureaucracy become adaptable. How can we meet people where they are instead of following a protocol just for the sake of it? So I'm inspired by this adaptation and how it might move our work in civic tech forward, easing barriers for people to get help when they need it.
I think for us as well, a lot of things we learned weren't totally new, but they really emphasized to us some of the things that we sort of theoretically knew turned out to really apply in real life. And the first one is really just that starting small is really important, even when you're in an emergency situation like getting food to hungry kids. It's important to take the first step and have it be small. We were able to do a limited rollout of this and start accepting applications from a small pool of people. And during that, we caught some pretty significant bugs. And really, with any technology project, you're going to make mistakes. The question is just whether you want to make them on like a small scale or a really big scale. And I'm glad we didn't make those mistakes with all, 3 million Californians that we could have. And on a more general level, it really let us prove to ourselves that we could design and build at this speed. You were lucky to not always have a lot of external deadlines, but in this case, we did. And it was important for us to prove this to ourselves because the next pandemic-related project that we took on, we only had half as much time to get out the door. So PBT was really good practice for that.
And then I will say I'm like a walking contradiction, right? Because I definitely think that speed is important, but I think you also learn that you have to go slow to go fast. And that is to say that even when you're moving quickly, you still need to take a minute, as Rachel suggested, to think about your client and their needs, to test, even if it's on a very limited scale, and to ensure that you have that infrastructure on the back end. Because in addition to making benefits available quickly, it's also our responsibility as government to offer stability and make sure that we're able to serve our clients. And that's often, we use the word bureaucratic, and I think that's because we are intended to be kind of a stable source of support. And um, I hesitate to even use the word bureaucracy, because I think we should bring some sense of stability. And so we need to make sure that even though we're moving quickly, we're able to do what we've committed to doing on behalf of our clients so that they can access those benefits. So the go slow to go fast is our key lesson learned after pandemic EBT, and something that we apply to our work on a regular basis.
I've heard it said that the deliberate pace of government is a feature and not a bug.
Yes.
Um,
Every day.
yeah. Can I get someone from each project to talk about how you define success?
I'm
Alexis, do you want to
actually,
start, or Joanne?
I was saying I'm happy to start. I think success for us was really measured by, how many young people were accessing the site, how long they were staying on the site. And I think it was really gratifying, looking at the analytics to see that young people were coming to the site, they were actually using it. I will say that it wasn't just the site by itself. A lot of our partners had really strong social media networks that were directing people to the site. We also were working with the school district and their wellness centers staff to direct young people to the site, as well as providers to direct young people to the site. But it was also really heartening to see that there were we provided information as well on COVID and safer sex during COVID and that sort of thing, and to see that young people were actually accessing that information and spending time with it. On the back end, while we didn't do any formal surveys, we do believe that the site had some impact on young people accessing services, just anecdotally from our providers as well. And I don't know if you have anything you'd like to add to that, Wendy.
Yeah, based on our analytics, we found that the average time spent on the page was 5 minutes, which was pretty great, and that people were looking at the entire page. So we have a lot of essential information, but also supplemental information like FAQs, and that was being reviewed and digested. And based on that, we really like, how can we optimize the page for better usage? So things like, making the phone numbers clickable so teens can just like dial directly on their phones. And then, like Siobhan mentioned, sharing that campaign on other social media.
Well, and then for us on the pandemic EBT side, we were obviously tracking all kinds of data points. How many cards, how many groceries purchased? And, there was a day where we topped the $1 billion in groceries purchased. And of course, there's this celebration and you're feeling excited. But I actually think the greatest measure was when we interacted with clients and you heard how much something like $365 means to a family in terms of their ability not only to feed their kids, but to feed everyone in the household. And just the client interactions. And for some it was difficult and not everything went perfectly, but when you do hear from folks that it was of value to them and it added something so critical to their day-to-day lives, that I think was success for us. And we enjoyed being able to engage with clients directly. Is something we don't usually do at the state. So that I think kept us going. And I know we were sharing stories with the code team and others, but that was really success for us. Yeah.
Yeah, and I would add to that, I mean, obviously the number one measure of success for us was getting as much money into people's hands as possible. But in terms of making sure that the experience of getting there was good for people, we had about like a 95% client satisfaction rate, which is always great to see. And time to complete the application was under 4 minutes, which I think is also really important, especially because at the end of the day, there are going to be some people who apply and don't have their application approved for whatever reason. So making sure we don't make them go through more than they have to. And for people who are eligible, making sure that the process of getting there is as painless as possible was really important.
Thank you. So we have a few questions. Vladimir asks, speaking about expediting the bureaucracy, I'm curious about how you managed to set expectations with stakeholders in order to strike that fine balance between expected quality versus speed. And I would add to that, how were you able to get sort of buy-in to pilot particularly the PEBT stuff with a smaller group rather than trying to get, like all the benefits to all the people immediately?
So I can start, Rachel, and then hand it over to you. I will say for us, we try to be as transparent as possible with stakeholders. So we try to share both what flexibilities we have and what limitations. For example, there are only so many cards that you can print in a given night, no matter what. Like the printer only issues X amount of cards at maximum with no interruption per night. So like there's an inherent amount of time we need to just issue 4 million cards, and there's nothing we can do about that. And so those types of facts, we have to be transparent with them so people understand where are their limitations and where do we have flexibility and where are we trying to be more creative. So I think we had with Code and our partners at CDE several stakeholder webinars. We sent updates to our stakeholder community. We tried to keep them in the loop about some of the initial data outcomes so that people could see the big picture. We tried to address as many client issues as possible. We were open constantly to kind of receiving messages and helping tackle issues with our stakeholders. So I think it's really about transparency and letting people know when your hands are tied and when you have more flexibility and you're thinking creatively about how to use that. So Rachel, I think if you have more to add, you were engaged in a lot of our stakeholder work.
Yeah, absolutely. I mean, I think a big part of it was that we did have this existing relationship with CDSS, so they kind of know what we do and how we do it, and they knew that they could trust us to deliver this on time, but also that we have a lot of opinions about how things should be done, and there's things that we won't do and things that we feel like is really necessary to do. And I think similarly, transparency helped a lot. I can't speak very much to the data matching side of things because that's more technical than I get, but there are limitations to that. And we had to sort of spell those out and say, there's certain ways that we can identify people or not identify people. And, theoretically, you could look at addresses and draw certain conclusions, but our opinion here is that you're not going to get accurate data out of that. So our proposal is to go forward in some other way. So just really being honest and upfront about that stuff is important, I think. In terms of getting permissions to do the pilot, Alexis might know a little more than that. We're lucky to have a great program staff here who sort of deals with that stuff, so the product side of the house doesn't have to worry about it. But I do know that pilot, part of what was involved in that was an experiment to do some outreach to current CalFresh clients to see if we could send them text messages and encourage them to apply for this if we identified that we thought that they would be eligible. So I think there was also definitely an interest on the state side in knowing if that would work.
And so it was a relatively small pilot. It was butted up right against the regular launch, right? You don't want to create too much of a gap as it can create client confusion even for a very limited group. And then I believe we did some communications with clients so that they knew that they were involved in a pilot, right? So you understand what's the soonest you can get your benefits, whether you're in the pilot or through the normal application, that's going to be the same date. We couldn't go any faster. So I think even that level of client transparency helps in really having a small gap between the small pilot and the launch, and being nimble enough to adapt what you learn from that was the key for allowing us to say yes. Because typically you don't roll something out before it's fully cooked, right? Because you have some equity issues. And so we try to reduce those as much as possible.
Great. What about on the city side?
So I think transparency again was key. I think we had the template itself created some expectations for what we were going to be able to achieve, and I think what we did is we brought together our stakeholders and showed them the template initially, and we're taken through it, so we already knew what those expectations were. I think one of the things that was useful was that everybody had a stake in this, and that, you know, our primary of that large number of stakeholder organizations, there was a small group of people who worked on this. Not everybody owned any piece of the content. I mean, different pieces were owned by different people. And so I think that sort of engagement at the ground level. The other thing is, by engaging all of our stakeholders at the ground level and helping us to create content, they had direct contact with young people who were able to give us ongoing feedback on what we were creating. So I think that helped to, you know, to create a real excitement about the project, and a real commitment from multiple, you know, multiple agencies. And I think that enabled us to have a product that people were excited about rather than disappointed in, because everybody had a finger in the pie, so to speak.
In terms of managing expectations, we had a close partnership with the Department of Public Health stakeholders from day one, and including them in like every step of the way, inviting them to like guerrilla user testing intercepts at community clinics, this pre-COVID, and inviting them to our meetings, sharing our iterations, our product roadmap, and shopping it around to programs within the department. So it really established a sense of ownership amongst our partners and internal stakeholders. And there were never any surprises because they were very much integrated into our team as we're building.
Excellent. Those are all really excellent techniques. So Nevi asks, tech people also want to help out in these situations, and sometimes that backfires because they don't know where to go or they don't know how to offer their correct skills. I know for both these projects you built on pre-existing relationships, but can you give any tips for how California or San Francisco government and the tech industry can better engage with each other?
I would start off by just sort of entering into it with some humility, and having an understanding of what your sphere of expertise is, but also respecting others. So, you know, as a technologist, your expertise is in technology and in looking at how you can sort of logically take things apart and put them back together. And it's so important to work with the people who are on the ground already, and have experience with whatever your subject matter is. So, you know, whether that's like a public health clinic or someone who's working in school nutrition, and especially the people who are affected by whatever you're working on, and finding a way to let them be the people who can tell you what the problems are, and look at your job as how to solve that with the tools that you have, and knowing when it's not possible to do that. Technology helps in many situations, but not all of them.
Thanks, Rachel. Yeah, I think also I was wondering more of, like you mentioned, listening to the people who are experts, but I think there's like a massive gap in even knowing where to find those people and who they are. And like, I don't know, I think there's a lot of tech people who know what their skills are, but again, don't even know where to listen or learn about these problems to do exactly what you just said.
Oh, I can speak. My program is located in, the health department is huge in San Francisco. It's over 6,000 employees. And my branch is a very small branch, maternal and child health, the branch in which my program is located. What I can say is that it has been really helpful, and I think we really want these services and we want this help. Part of it is that we also don't necessarily know how to forge those connections initially. I think at least in our branch, when people have sort of approached administrators, and I think, again, this is what Exegy did essentially, even though you were hired for this project through the city and county. I mean, you approached us also and said, and in a very collaborative manner said, this is what we're doing. We'd like to collaborate with you on this. And I think we jumped at the chance. And I think that yours is one example, but I know that in our section, different programs have worked with other tech companies in the same way. And some of it is knowing what is available and is offered as well. I don't know if you have anything to add to that, Wendy.
I would say that because Exegy has been working in the civic tech space, we've built a lot of relationships. But that is also going back to Rachel's point, like we're coming at it in a very humble way. We may be like designers and engineers and product strategists, but we need to partner with the champions within government, the people who are doing the day-to-day work, to really understand and listen and learn from you. So I do believe there are opportunities to connect, and I would encourage maybe just to reach out to CBOs and just to kind of start some conversations to see what those needs are.
Yeah, there are also organizations like, at an individual level, a great way to get involved, of course, is a Code for America Brigade. There are also the US Digital Response, or maybe it's the United States Digital Response, which I think was formed in response to the COVID crisis, but I believe is intended now to be kind of a longer term project to help folks get involved in precisely this kind of work. But in most cases, the examples I've seen that have been most successful have been, in fact, built on pre-existing relationships. So the best way to be prepared for a crisis is to have done some relationship building and working alongside government folks in calmer times, which allows you then to really respond quickly and in ways that respect the expertise of everybody involved. Tamina asks, panelists, how are you handling client satisfaction surveys and other such evaluation tools now that COVID has restricted us to almost entirely electronic communication, particularly for Tamina's group, which I believe is in Contra Costa, which has a lot of non-technical and non-digital customers. And there's a specific question, another further question specifically around website analytics, and maybe you can work that in as well to that discussion.
Wendy, can I turn some of that over to you for us?
Maybe we haven't. To be fair, we haven't done a whole lot of tracking. We're taking a more incremental approach, and I would say that the feedback that Siobhan is getting from the CBOs and from the teams, the qualitative feedback right now is pretty essential in shaping the direction of the next iteration.
I can say, and I'll back that up. I mean, I think that, again, we are dealing with really, not only are we dealing with having to do everything digitally at this point, or almost all of it virtually and by telephone, but we are also really short-staffed. And so we've done what we can repeatedly, on an ongoing basis to engage young people in looking at the site and giving us feedback on the site. in getting providers to ask young people about the site, about whether they've used it, that sort of thing. But you're right, a lot of this has been it hasn't been as systematic as we might normally have done, but I think it's been helpful what we've been able to get with the staffing that we've had.
And the California team, I think you all called out specifically some of your website, your satisfaction numbers.
Yeah, I can.
How did you, yeah.
So, I mean, obviously we have a digital product, so it's not necessarily in person. So I don't know how helpful that is, but our approach is usually to build that sort of thing directly into the product if we can. Our philosophy is definitely that we're not here to waste people's time. And although there might be lots of demographic and other information that we might like to know, we're not going to require people to answer those questions if it doesn't help them in some way. So we do have a user satisfaction, survey. It's like a 3-question, like smiley face, sad face, meh face. Like, how did you feel about this process? So very lightweight. And then on the final page of the application, this sort of, after you hit submit and we say, here's your next steps, on that page, we have the user satisfaction survey. So it's totally optional, but the people who choose to can easily just sort of indicate how they felt about it, which is good and important, but definitely not the end all and be all of it. Definitely usability testing was a big part of this, which is something that's harder to do for sure during a pandemic, but still feasible. So we were able to sort of use our networks to recruit some families who were possibly eligible, and then over Zoom do some usability testing with them, walking through the website, asking them to tell us, what do you see? What do you think this means? So we got a lot of really valuable feedback that way. And I think the other thing is just sort of looking for something like this that is a service that's so vital to people. If they have a problem or an issue with it, they will find a way to reach out and tell you about it, even if you don't have sort of an official method to do that. So we were able to stay in close communication with CDSS and with the vendor who was providing the EBT cards, and they could tell us about sort of the questions they were getting, the problems people told them that they were having. So that was a really valuable source of insight for us as well into things that were maybe not working for people. And finally, we do have the website analytics, and we're always looking at those. Obviously, we're very concerned with like how long it takes to complete the application. We sort of know how many pages it is and have a general sense of what we think it should take. So if we're seeing like numbers we don't like there, that's an indication that something's not great. What else? I can't say off the top of my head exactly what we were tracking, but definitely looking at sort of error rates for stuff as well. That's how we discovered like we were collecting date of birth in a way that was not quite correct, and we were able to notice that. So yeah, looking at people, even if you can't directly get feedback from people, looking at how they're interacting with your service is one of the key ways to find out what's going on.
And then
we have 2 more minutes, and there's one more question for the California team that we need to get in right quick.
Okay.
Anne asks, anything you hope to do differently or stay the same if a second round of PEBT becomes available?
Well, it's like they read my mind on what I was going to say, which is in addition to client satisfaction, I think there's this question of looking retrospectively about how you performed internally. We had to build new teams for this effort. We had to redirect staff that usually do CalFresh. We had to redirect research services staff. The Department of Education was involved, Code for America. So going through this exercise of a retrospective and listening back, not only from clients, but your internal teams, and then also from stakeholders who represent clients, kind of taking that all in and absorbing it and asking yourself, like, what would you do differently? And I think, if I had a magic wand, I'd actually put Code for America out of business. Sorry, Rachel, but we wouldn't have to require an application, right? That's what we did it because we had to. We don't think that that was the ideal. And so if there's a solution where we can look at running this as a data exchange without having to add that extra step, I think we'd be interested in it. We're really happy with the success we had, but we recognize that even a 4-minute application can be a barrier for some. And so we are looking at creative thinking around how we might do that differently. And then there are questions about serving different populations that maybe are in childcare settings where we don't have data about them necessarily. And so again, more questions about data and how we determine eligibility. So I think that's what's on the horizon for us, is applying what we learned if there is a round 2 and trying to remove as many barriers as possible.
Thank you so much. So we're at the end of our time. I want to thank everybody for joining. Siobhan, Wendy, Alexis, and Rachel. It's been super interesting. Please stay connected with our various organizations. Both Exigy and Code for America have newsletters and Twitters and Slacks and things. You should feel free to sign up for either newsletter. You can find the panelists on LinkedIn, I'm told. And hopefully, we'll be able to have continuing conversations. Well, thanks everybody for coming. Thanks for the really excellent and incisive questions. And thank you to our panelists for really telling us about some of the fantastic work that's gone on in response to the crisis that we're dealing with. And thanks Exigy particularly for really being the backbone of organizing this event. Have a good day, everybody.